Welcome to MedTech Evolution video series, BPACNZRx, Creating a New Medical Warning. The accurate recording of a patient medical warning is critical to the continued well-being of a patient, especially in the areas of allergies to medications and vaccines. Recording a medical warning helps ensure the patient is not prescribed a medication or administered a vaccine that may have an adverse effect on the patient's health. Important to note, recording of vaccine allergies. There is currently no link with the vaccine allergies in the immunisation module. The patient's medical warning list must be manually checked prior to administering a vaccine. The medical warnings in BPACNZRx have been designed to allow the creation of medical warnings more effectively and efficiently via the use of radio buttons and predictive searching. So we'll open a new medical warning. And the first option is no known allergies. So if the patient has no known allergies, simply click OK. So when the patient does have allergies, first field is date of onset. The date of the allergy event is identified and should be recorded. This field defaults to today's date and can be changed by using the drop-down calendar. Type. Select the type of medical warning according to the type of allergy, and the following types available are medication. To select the required generic drug name or alerting group, type the first few letters of the generic medication name or alerting group in the drug field and then press the ellipsis button to display the potential matches. Type. Here are the potential matches. Select the one that's appropriate and OK. The search criteria can be further defined if what you're looking for is not displayed. In doing so, the display results automatically are updated. Other substance. To select the required substance, type the first few letters of the substance drug in the field below. So we will type milk and then press the ellipsis or the tab key to search for substances and select the one that is appropriate. Other important note. It should only be used if the medical warning does not fit into either of the other two categories. Other important note. Should only be used if the medical warning does not fit into either of the above two categories. To include the allergy-related information with this category could introduce a clinical risk for the patient and should be avoided. For example, a patient could have other important note and a no known allergy recorded. Hence, if the note contains allergy information, then the patient records are in conflict and will introduce a clinical risk for the patient. Medication and other substances predictive searches. A predictive search feature has been introduced in both Find Generic Name and Alerting Group. So we look at here again. A predictive search feature has been introduced in both Find Generic Name and Alerting Group. A predictive search feature has been introduced for Find Generic Name, Alerting Group, and Other Substance. A predictive searching feature has been introduced in both the Find Generic Name, Alerting Group, and Other Substance screens, which automatically displays matches based on what's entered into the search field. For example, B may be entered in Other Substance. And clicking on the ellipsis will bring up all words starting with BEE, which reduces the number of mouse clicks. By typing in more characters into the screen, fewer results are automatically displayed. When searching for other substances, the most common allergic substances are displayed at the top of the list in alphabetical order, and therefore, if the patient has a common allergy, no search criteria is required. So we have the top list of patient allergies listed here, and then the rest are alphabeticized underneath. The next entries to be made in the new medical warning, severity. There are 3 levels of severity can be specified. This requires clinical judgment in relation to the patient's reaction to the drug or substance. Severe. This should be selected if the medical warning is life-threatening or severe enough for the substance not to be prescribed. In the case of other substance, the search is limited to peanuts and egg-based products. Moderate. This should be selected if the medical warning is moderate or not severe enough and the substance can be prescribed again if necessary. It's an alert that indicates alternatives should be considered, but may be ignored based on clinical judgment. Mild. This should be selected if the medical warning is mild or tolerable for the patient, allowing the warning to be ignored if necessary, in conjunction with clinical judgment. It is an alert that may be ignored or indicates that alternatives should be considered. Severity of medical warnings is a new feature with radio buttons alongside the grading of mild, moderate and severe, which will also be applied to medications. There is no default value of severe for a new medical warning, so it must be selected based on clinical judgment. Once a severity value is selected, for example, mild, it will be emphasized in bold on the font and the other values are left inconspicuous. When severe is selected, it is emphasized in red bold font. If you mark the allergy, important note, if you mark the allergy warning as severe, i.e. life-threatening, then in the interest of patient safety, the system will prevent accidental prescribing of the medication. If the severity of moderate or mild is selected, then a warning prompt is displayed during prescribing to help ensure that it is not overlooked. However, the mild warning prompt can be suppressed within the staff setup, but it will still be displayed in the interactions and warnings area when prescribed. The next section to be filled is note. The note field here. Should it be necessary to add an additional information in relation to the medical warning that's not covered in the other fields, then it can be entered in the note. In the case of other substance, you will receive a flag here called script warning. This field only appears when a type of other substance or other important note is selected, and it's ticked by default. If this field remains ticked, then the other substance or the other important note, medical warning, will be displayed in the script interactions section when prescribing a medication. Provider. Specify the staff member who recorded the patient medical warning. This will default to the logged-in provider. After entering the required details, clicking OK will apply the validation rules and save the medical warning for the patient record. During the save process, the following information message will be presented to the user if they have selected a medical warning type of medication, advising them that the medical warning for specific medication has been created, and will prompt alert messages at the time of prescribing. During the save process, the following information message will be displayed to the user if they have selected the medical warning type of medication, advising them that the medical warning for the specific medication has been created, and will prompt alert messages at the time of prescribing. If the new medication warning was marked with a severity level of severe, the following information prompt will also be displayed. In the medication warning list, the severe will be displayed in red.